A profound health challenge faces humanity as a global analysis published by the Lancet journal reveals that more than 1 billion people around the globe are now clinically obese. The most recent data from 2022 demonstrates that a staggering 879 million adults and 159 million children fall into the category of obesity, with the UK alone accounting for approximately 16.8 million of those affected. The alarming statistics come from a collaboration between the NCD Risk Factor Collaboration, an international network of health scientists, and the World Health Organization, WHO. In a period stretching from 1990 to 2022, obesity rates among children and adolescents quadrupled and more than doubled among adults, thus making obesity the most common form of malnutrition in many countries. Senior author Professor Majid Ezadi from Imperial College London encapsulated the gravity of the situation by underscoring the fact that the obesity epidemic, apparent in adults over 3 decades ago, has now manifested among school-aged children and adolescents. At the same time, undernutrition continues to affect hundreds of millions, predominantly in some of the world's poorest regions. The study emphasizes the necessity to improve access to healthy, nutritious foods to effectively combat both sides of this malnutrition spectrum. Despite a decrease in underweight rates globally, there were still approximately 532 million underweight individuals in 2022, making the issue of malnutrition extremely multifaceted. By analyzing body mass index, BMI, across data from 3,000 population studies comprising 222 million individuals, the researchers mapped the transitions in obesity and underweight levels over 30 years. According to the NHS, for adults, a BMI over 30 constitutes obesity. Although admitting BMI's limitations, due to factors like muscle mass, it remains the most consistently recorded measure in population-based surveys. The highest prevalence of obesity is found in regions such as Tonga, American Samoa, Polynesia, and Micronesia, Cook Islands, and Niue. The UK's adult obesity rates soared from 13.8% for women and 10.7% for men in 1990 to 28.3% and 26.9%, respectively, in 2022. The obesity rate for UK children also witnessed an alarming increase. Dr. Tedros Adhanom Ghebreyesus, the Director General of WHO, highlighted the significance of addressing obesity from early life through diet, physical activity, and care when necessary. Achieving this requires collaborative efforts among governments, communities, and the private sector, with a call for accountability for the health impacts of products. The NHS is tackling the epidemic through its specialized clinics for those grappling with extreme weight issues. But Professor Simon Kenny, NHS England's National Clinical Director for Children and Young People, asserts that this is not merely a health sector battle. The societal and industrial actions are critical in preventing a looming health crisis that could result in grave ramifications for future generations, including an increased risk of chronic diseases such as type 2 diabetes, cancer, and significant mental health issues.